A pleasant afternoon to everyone. Completing a research paper can take months or even years to move from an idea generation and design to data collection, analysis, and writing up the results of the study. And it does not end there, because one of the goals of research is to make your findings heard and accessible in order to contribute to and share the most recent advances and gaps in the field. Thus, we are gathered virtually today for our nursing research colloquium. Without much further ado, may I invite everyone to invoke the Almighty as we begin with a prayer.
Let me be the change I want to see, to do with strength and wisdom all that needs to be done, and become the hope that I can be. Set me free from my fears and hesitation. Let the courage and humility fill me with spirit to face the challenge and start the change I long to see. Today I start the change I want to see. Even if I'm not the light, I can be the spark in faith, service, and communion. Let us start the change we want to see, the change that begins in me. Today I start the change I want to see.
Even if I'm not the
Even if I'm
light,
not the light, I can be the spark. Faith, service, and communion. Let us start the change we want to see, the change that begins in me.
Jesus in us.
Jesus in us.
And now, to kick off this research colloquium, may we request our Dean of the College of Nursing to give her words of welcome, Dr. Tony Ann B. Lachica. A virtual round of applause for her, please.
Thank you so much, Ms. Dean. Welcome, everyone, and thank you for joining us in this nursing research colloquium, colleagues and nursing students. There are 3 great research outputs to hear and learn from, which would surely contribute to our development. We have topic related to clinical supervision by Dr. DIVA, the experiences of our international students by Dr. Trajera. Actually, she has participants from undergraduate and graduate studies. And the third research study is on flexible learning modality in nursing education by Dr. Yang. We invest in activities like this to improve our knowledge and practices, and also build our skills, work approach, and even confidence in the application of our nursing actions. Before we begin this colloquium, I would like to express my heartfelt gratitude to all of you who sincerely committed to this event to make it a success. This event would have been impossible without the support of each and everyone present here. To the presenters again, Dr. Trajera, Dr. Diva, and Dr. Young, congratulations for these great research studies, and of course, for the completion of your degree, Doctor of Philosophy in Nursing. May you continue to do research and mentor those who are willing to write research, especially our nursing students. So for sure, everyone is now eager to listen and learn. So again, welcome and pleasant afternoon to all.
Thank you so much, Dean La Chica, for your welcoming words. Moving along, I am going to introduce to you our research presenters for this afternoon. Indeed, it is a great opportunity for all of us attendees to get a first-hand insight and information from the results of their studies. We have, as mentioned by our Dean, we have first Dr. Marybeth P. Diva, one of our level 3 clinical instructor, to present her study on clinical supervision in the changing landscape of nursing education. We also have Dr. SHEILLA M. Trajera, our coordinator, research coordinator in the College of Nursing, at the same time, the director for the Center for Linkages and International Affairs on her study entitled Bridge Over Troubled Water, the lived experiences in nursing education of international students during the COVID-19 pandemic. And we also have Dr. Leslie E. Young, one of our clinical instructors in the level 2, who will present her study on quest for independence in the delivery of flexible learning modalities in nursing education. So everyone, you know, when we present or presenting our research study in conferences or colloquium like this one is perhaps as important as conducting it, because this is how most people will be able to understand your procedures, discuss your results over feedback of your output. So this time we are going to view and listen to the different research video presentation. First, we have Dr. Marybeth P. Diva.
I am Marybeth P. Diva, a faculty of the College of Nursing, University of St. Salle, and my study is entitled Clinical Supervision in the Changing Landscape of Nursing Education. A clinical supervisor's job is a challenging task, for it covers all skills development activities related to patient care with the individual nursing students. Clinical supervisors' experience of overseeing nursing students' clinical exposure provides greater insights to the development of an effective clinical teaching strategies in an outcomes-based nursing education. The supervisor's primary responsibility is overseeing that the objective of clinical exposure of the nursing students are achieved with proper and effective guidance of a nursing faculty. The supervisor's role is to guide clinical nursing faculty to a learning environment in a clinical setting where trust dominates the relationship between the teacher and the learners. A supportive supervision will guide teachers and administrators who want to create a good learning climate and a culture that encourages professional growth and development. The schematic diagram illustrates the conceptual framework of the study. The Proctor's model of clinical supervision was utilized. The normative, formative, and restorative models. Normative maintains the standards of practice reflecting on the current practice. The formative model is defined as the learning, the opportunity to become, and reflective in the current practice, and restorative, how management, capabilities, learning, and support is evident. The demographic profile of the study participants are the clinical supervisors as to the profile of their age, their sex, marital status, educational attainment, the number of years of clinical experience, and the number of years of teaching experience. The lived experiences of the clinical supervisors of the colleges of nursing of Bacolod City and Negros Occidental, of clinical supervision in the changing landscape of nursing education in an outcomes-based nursing curricula, and the proposed clinical supervision framework. The purpose and objective of the study The study aimed to explore the lived experience of the clinical supervisor of the different colleges of nursing of Bacolod City and Negros Occidental in the changing landscape of clinical supervision in an outcomes-based nursing education. The objective was to develop a clinical supervision framework to achieve personal and professional standards in nursing education. This framework may enable the faculty to identify their educational advancements and training needs, supervision supports, clinical competence, quality care, and professional insights, with emphasis also placed upon reflection, self-awareness, and therapeutic use of self. Furthermore, the result of the study will serve as a basis for the creation of a relevant proposed clinical supervision framework. The research design is a phenomenological design utilizing in-depth interview among the clinical supervisors, which is defined as examination of the human experiences through qualitative, descriptive methodology developed from the phenomenological philosophy for the purpose of describing experiences as they are lived by the selected study participants and interpreted by the researcher. The data in this study were gathered through an in-depth interview with the clinical supervisors in the different colleges of nursing. Questions were directly asked to each participant to examine their personal views and opinions with regards to the new landscape of clinical supervision in an outcomes-based nursing education and how they individually survived and continue to face the challenges of the new normal. The participants of the study include the 6 clinical supervisors from the 6 colleges of nursing in Bacolod City and Negros Occidental. The participants of the study were the current clinical supervisors committed in addressing the demands and developing needs, alignment, and improvement of the curricula to equip the nursing students with the skills, knowledge, and enriching clinical experience. The clinical supervisors were in charge of the rotation plan and students and faculty placements for both clinical skills laboratory and clinical duty exposures. The participants of the study were identified through purposive sampling method based on the criteria established and based on their current position as a clinical supervisor and employed in the 6 different colleges of nursing. For the instruments and data gathering procedure, the study utilized a researcher-made interview guide to obtain relevant information through asking questions. An interview guide was prepared for the clinical supervisors designed to gather relevant data for the presentation of this study. The first part gathered information on the demographic profile of the study participants. The second part explored the clinical supervisors' prevailing supervisory practices, opportunities for growth and professional development, the challenges they encountered, and the administrative support. The third part were the lived experience, performance of their function, and their coping strategies of the clinical supervisors in the new normal outcomes-based curriculum in nursing education, and the framework suited for an effective clinical supervision. Open-ended questions or options were provided to accommodate free-formatted views which were related to the study. For the data analysis and ethical consideration, Guba and Lincoln's concept for defining and investigating quality in a qualitative research was utilized in the course of the study. Pollitt and Beck emphasized trustworthiness as the rigor of the study, referred to the degree of confidence in the data, interpretation, and methods used to ensure the quality of the study. In each study, researchers should establish the protocols and procedures necessary for a study to be considered worthy of consideration by readers. This criteria included credibility, dependability, confirmability, and transferability. They later added authenticity. Credibility of the study, or the confidence in the truth of the study and therefore the findings, is the most important criterion. Permission was sought from the study participants for their voluntary participation in the study, hence a formal communication was sent to the participants. Careful consideration regarding the participants' identity were ensured so as to retain privacy and confidentiality of the information disclosed. A pseudonym was assigned to each participant. For the results of the study, thematic insights on the lived experiences of the clinical supervisors. were considered. The theme one was identified. A nurse is a nurse no matter who you are. Nurses as nurturers. For the sub-theme 1A, lead the mission. We are all created equal and unique, patterned to the image and likeness of God. Though we get our fair share of intelligence, talents, and abilities, behaviors, and attitudes. The bottom line is that the focus should be on what the individual is inspired to do, their life's purpose, and what they could contribute to the profession, the nursing profession as a person. Sub-theme 1B, lead by example. Nurses are family. Nursing is more than a profession. It is a vocation. It is fulfilling the mission. Nurses go beyond the call of duty. Nurses share this mission and connect with one another on a deeper level, allowing them to forge strong relationship that is beyond affinity that lasts a lifetime. For the second main theme, bearing the weight of responsibility. For sub-theme 2A, more than a job. Clinical supervisors are nurse managers and are expected to make decisions and solve problems as part of the job. Critical thinking, analysis, evaluation, inference, problem solving, and deductive reasoning plays an important role in making decisions and solving problems. Sub-theme 2B, learning together. The uncertainty of the pandemic is realistic. The academic communities urgently and abruptly shifted from the traditional face-to-face classroom discussion and clinical exposure to purely virtual online platform. No one can resist learning and adapting to technology and develop an LMS program catered to the needs of the learners. Passive technologization is here and is here to stay. Sub-theme 2C, challenged by challenges. The emerging concerns among nursing students, parents and guardians, and clinical affiliates about learning quality is gradually being addressed. Nursing education is still committed to quality in preparing nurses. Clinical supervision envisioned faculty flexibility to create a safe virtual clinical learning environment without compromising real-time hands-on learning experiences. Sub-theme 2D, we are all in this together. The pandemic reshuffled our normal lives and how we run it. Technology replaced the way we used to live. These new subjectivities will exhibit increased capacities for voluntary obedience and programmable functioning abilities, leading to a new normal, benefiting those who are adept in technology and software-structured social relationships. Academic institutions invested so much to educate the faculty with the LMS. Technology more than ever became a necessity. Online subscription increased and majority of professionals work at home. For significant statements on the lived experiences of the clinical supervisors in the new normal OBE nursing education. Theme 3 was identified with the title, The Realities of the New Normal. For sub-theme 3A, Leave the Normal and Leave the New Normal. The pandemic has gradually controlled nursing training institution moves into recovery mode, with institutions and governing bodies implementing policies and measures to regain lost hours and clinical experiences at real time. Multi-sectorial intervention was afforded by the Commission on Higher Education, the CHED, the Department of Health, and the Professional Regulation Commission Board of Nursing. The delivery of content online introduced innovative methods of assessment and some anxiety in students for which virtual assessments are new. Sub-theme 3B, no compromise. Nursing education is the first port of call. Must leverage on the innovative practices to prepare the next generation of nurses for the arduous task ahead. Virtual simulation and simulation laboratories augments this learning experience by allowing students to practice the health assessment skills on technological modalities and machines rather than actual patients, replicating the clinical learning environment. The fourth sub-theme was identified as completing the puzzle. For sub-theme 4A, opportunities versus challenges. DeWart et al. Nursing Education in the Pandemic states students express concern about what an interruption in their nursing education would mean for their future careers as registered nurses. It is critical that we reclaim the importance of supervision, the role it can play providing both theoretical frameworks to rethink education and reimagine the practical and hands-on application to improve learning outcomes for students. Subtheme 4B, Uncertainties. This is a time in nursing that the divergence of the concepts of theoretical knowledge into clinical practice skills in the complexity and amidst uncertainty of the healthcare system and its system of operation is emphasized as uncertain due to patient safety as well as appropriate safeguarding of the nursing clinical instructors and learners. Subtheme 4C, the missing pieces. The diversity of how nursing educators, clinical instructors, and clinical supervisors envision leadership in the infinite impossibilities and possibilities to address the demands of a spontaneous, standardized, and uniformity of programs aligned to the OBE curriculum with consideration to government protocols and the higher education policies and the challenges and attempts to mitigate clinical placement still remain crucial. For the conclusion, the divergence in the prevailing practice of clinical supervision differ from one institution to the other, but the delivery seems undistinguishable. The first major theme emerged: a nurse is a nurse no matter who you are, the nurturers of the future. The clinical supervisory position is female dominated. To the academic institution were long enough ability. Pandemic must never be taken for granted. The third major theme emerged as the realities of the new normal. The new perspectives of reality have reached to a new height. Difficult and forced changes in the way people think and live, whether we are ready or not so, technology had become a part of our daily lives. The fourth major theme emerged as completing the puzzle. The overwhelming responses to the uncertainty brought about by COVID-19 pandemic remains to be seen, and how it enabled everyone to call and adapt to the different changes and how the journey continues in nursing education. For the proposed clinical supervision program, Transitional Readiness in the New Normal, OBE nursing curriculum, clinical supervision plays a very, very important role in nursing education and in every nursing institution. How we adapt to the institutional mission and vision, the delivery of our purpose, the pedagogical and clinical competencies, our transitioning to the new normal, team building, and resilience and readiness. All are expected to have a competent clinical instruction and clinical instructors, enhancing trust and competence. And for the students, our students are honed and geared to be prepared at all times.
Thank you so much, Dr. Diva. Let's give her a virtual round of applause, please. So her study highlighted, or some of the highlights of her study revealed that the clinical supervisors are called nurturers because they lead the mission. They lead by example. And as clinical supervisors, they also bear the weight of their responsibility. This responsibility is more than just a job, but that is why it is very important that as clinical supervisor, you also learn together with the team. And as a clinical instructor, part of the weight of your responsibility are the different challenges. Some of the challenges that were mentioned were the concerns of the students, concerns of the parents, concerns of the clinical instructors themselves, and concerns with the technology. That is why it's also very important that one of the skills to be developed by a nursing supervisor is the acceptance of the new normal by living with it but without compromising the nursing education. Madamo gid nga salamat, Dr. Diva. At this time, we will be listening to the presentation of Dr. SHEILLA.
Good afternoon, everyone. And I would like to thank those who came and joined us this afternoon for this afternoon's research colloquium. So today's sharing will cover my study on bridge over troubled water, the lived experience in nursing education of international students during the COVID-19 pandemic. For the background of the study, the COVID-19 pandemic affected most students' lives, particularly in nursing education at the undergraduate and postgraduate program levels. In the Philippines, the Commission of Higher Education, or CHED, passed the Memorandum Order Number 4, Series of 2020 on the guidelines in the implementation of flexible learning, hence our implementation. Study conducted by Josie et al. In 2020 shows that student experiences on blended learning in higher education revealed 4 key themes as 1. Active learning, 2. Technological barriers, 3. Support, and 4. Communication, suggesting that when delivered purposefully, blended learning can positively influence and impact the achievements of students, especially when utilized to manage and support distance education. Savitsky also et al. In 2020 highlighted the prevalence of moderate and severe anxiety associated with gender, lack of PPEs, and fear of infection, particularly with the higher anxiety score among nursing students. The information derived from the lived experiences of the participants from the BSN and the PhD programs is expected to yield essential information that will assist the researcher as an administrator in promoting internationalized education that considers the best interest of our international students. At the nurse educator's vantage point, the researcher only hoped to arrive at a vivid, unadulterated, and in-depth understanding of the phenomenon, which might help review policies and internationalization programs for the Lasallian international students in the enhancement of nursing education, both in the undergraduate and graduate programs. Here is the schematic diagram, which already incorporated the different themes that are surfaced in the study. So for the first box, we have in there the different profile variables in qualitative we express in the study, namely age, nationality, country of residence with online class during the pandemic, program currently enrolled, either BSN or the PhD nursing program, gender, civil status, online platform use in online classes during the COVID-19 pandemic, work affiliation and specialization, especially for PhD in nursing program students, and reason for enrolling in the nursing program, which is actually quite very interesting. The lived experiences in nursing education of international students surface the following as concluded. Divergent responses to the challenges in the trifocal areas of nursing education during COVID-19 pandemic, which includes teaching and learning, research, and engagement. Also, we have salient features in the lived experiences of international students in nursing education with the COVID-19 pandemic, and very interesting, lessons learned by the international students' experiences of nursing education during the COVID-19 pandemic. The purpose of the study was to explore the lived experiences of participants in the nursing education of international undergraduate and postgraduate students during the COVID-19 pandemic. As for the design, qualitative research design in phenomenological approach, in exploring the lived experiences of the 6 Salle international students in nursing education during the COVID-19 pandemic was utilized. The qualitative approach looked for more profound than the surface meanings of the phenomenon under study, which is the nursing education experienced by the nursing students, both in the BS and the PhD in nursing programs. For the participants in study sample, purposive sampling was used among 6 participants explicitly chosen for the study using the non-probability purposive sampling technique, 3 participants from the undergraduate and 3 participants from the PhD in nursing program, who voluntarily participated after having been invited to a letter and were assigned names that serve as pseudonyms. To maintain the anonymity of the individual students taken from the name of the nursing theorist chosen by the participants themselves before the start of the in-depth interview to free them from nervousness during the interview. For the inclusion criteria, first and foremost, the student must be currently enrolled in either the BSN or the PhD in nursing program for the first semester of academic year 2021-2022, is in the final year of completing the program during the COVID-19 pandemic, must reside abroad. While attending to the online classes, you might be asking, why is there a need for them to be in their final year? Now, because it's actually important that they have experienced the trifocal function of education, or all the possible experiences that they must achieve in their study of the program. Must reside abroad while attending the online classes, has been compliant in the retention policy of the program, and must have a good command of English language, and lastly, must be holding a foreign or immigrant status. For instrument, the interview guide was used and comprised of the following parts. For the first part, it concerned with gathering the participants' qualitative profile, namely age and years, nationality, country of residence, program currently enrolled, sex, civil status, and online platform use in online classes, work affiliation, and specialization. The second part explored merely the lived experience, which is the central question of the study of the international students in the nursing education program during the COVID-19 pandemic. For the data gathering procedure, the selected participants of the study were reached using Messenger, a letter of invitation together with the interview guide, and informed consent was sent with the details of the study proposal. This was actually done when the participants are no longer the students of the researcher. Some participants requested an interview guide, especially the PhD nursing students, given that English is their second language, to read the details of the study before agreeing to participate. The interview started with first making the participant at ease by asking about one's current feelings at the moment. The participants were made to choose and among the list of names of nursing theories with their significant contribution to nursing in setting the mood of the interview. So all of the pseudonyms were actually chosen by the participants. The study had the following steps. First, bracketing. Bracketing referred to identifying and holding an abeyance preconceived beliefs and opinions about the opinion under study, the lived experience in nursing education to the participants as international students. We will be seeing all of this later in our findings, especially from the lessons learned. Step 2 was intuiting. The researcher was open to meanings attributed to the phenomenon or event, nursing education during the COVID-19 pandemic, by the participants who have experienced it. Third was analyzing by dissecting significant meanings of statements and events by the participants. And fourth, describing by defining and interpreting the meaning of the phenomenon under study. The study ensured trustworthiness and rigor using principles of Lincoln and Gruba in 1985, which examined the trustworthiness of a qualitative study. These principles included credibility, which is actually established with prolonged engagement during the interview of participants until period of saturation, when the participant keeps on repeating the same statement and then could no longer add on to the new idea being asked for. Confirmability, practicing reflexibility wherein the researcher was being aware of and acknowledge one's contribution to the construction of meaning throughout the research process. Transferability was done with inclusion criteria in selecting the participants and providing a thick description of the participants' approved interview transcription of the experiences in nursing education during the pandemic. And dependability is creating an audit trail by documenting the process used in making decisions throughout the study to maintain the objectivity of the researcher. For ethical considerations, in order to safeguard the participants' welfare in joining the research undertaking, informed consent was secured following disclosure of the study's purpose. By self-determination, the participants decided to join in the study. Confidentiality and utmost respect were observed throughout the process. In terms of anonymity, each participant was made to choose a pseudonym among the first name of nursing theories to represent and conceal one's identity. Process consent, or the right to withdraw at any time with feelings of physical, psychological, emotional, and spiritual discomforts in the conduct of the study, was observed. Provision of online data storage, which was encrypted with a password to ensure confidentiality of data and could only be accessed by the researcher within 2 years, was taken into consideration. Here is our participants' profile. So we have the following. We have Betty, for Betty Newman. She was 32, a Chinese from China, and studying PhD in nursing, female, married, was actually using as a platform Zoom and Google Meet. And she works as a teacher in a vocational and technical college in China. And the reason for enrolling in nursing program is for her to improve one's research ability to make her knowledge and skills better. Second participant is Dorothea. She's 22. She's a Filipino immigrant in the US. She's residing in the United States, enrolled in the BSN program, female, single, makes use or made use of Zoom and Google Meet, a student, and she studied nursing to render service to humanity. For Florence, okay, she's 29, she's Chinese, she's from China, she's PhD in nursing student, female, married, and made use also of Zoom and Google Meet. She's a nurse educator in a vocational college, and she studied the PhD program because she wanted to work in a public university where better salary and work benefits are actually made available, okay, for greener pasture. For Phil, 24, is a Filipino-American from United States and enrolled in the BSN program, male, single, made use only of Zoom but not Google Meet, a BSN student and works part-time in food delivery service. You might be asking how much are they earning from their food delivery service? They earn as much as $150 to $200 per week for 2 days of part-time work. And that's actually $800 in a month, which is almost equivalent to 40,000 pesos in a month. That's only their part-time job for food delivery. And the reason for enrolling in the nursing program is to follow his sister's path of becoming a nurse. Rosano, 22, is a Filipino-American and also resides in the United States. He is enrolled in the BSN program, male, single, made use of Zoom, a BSN student and works part-time also in food delivery service. And he actually wanted to use the nursing profession as a springboard to pursue physical therapy. Virginia is 32, a Chinese from China, and studied the PhD or is studying up to now PhD in nursing program. She's female, married. She made use of Zoom and Google Meet in her studies. She's an educational agency agent, and she studied nursing PhD program because she wanted to have a better job opportunity in China. So these are actually the different themes that were surfaced in the study. First, we have divergent responses to challenges in the trifocal areas of nursing education. So first and foremost is the realities in teaching and learning with the threat of the COVID-19 pandemic. significant statement for Betty. She said online teaching is okay, although internet connection would be a factor in the teaching learning experience. Maybe the online teacher needs to improve their communication and feedback. Teachers are very good because we can communicate with each other effectively and immediately. So we are very thankful that they are actually trying to realize that we are there for them. Dorothea, okay, 22, a US immigrant and a BSN in nursing program student, said that teaching and learning, okay, as one of the trifocal functions of education is challenging during the time of the pandemic. I'm a visual and kinesthetic learner. When teachers talk physically in class, I remember the lessons well. I recall their gestures relating to the lessons. When shifted to the online course, I can hardly focus on the discussion because of external factors such as the connectivity of teachers, environmental noises, and alike, noises from chicken, dogs barking. So she said, don't have the opportunity to have a one-on-one conversation with the teacher, nor can I have the teacher and ask questions from her directly about things I cannot understand. And these actually opened my eyes, no, regarding the things that are actually experienced by our students abroad. Okay, and hopefully we can make changes on this, no, given the reality. Betty, on the second, okay, theme or sub-theme for divergent responses to challenges in trifocal areas of nursing education, on enriching research experience amidst the COVID-19 pandemic, said, I learned a lot about quantitative and qualitative research. I become more familiar with how to cope up with the study, a lot of website sources, learned a lot about difference between Chinese and other ways of doing research practices, such as in the Philippines. I learned a lot of nursing theories that are very useful in our nursing problem and coming up with theoretical framework. Dorothea, 22, US immigrant and BSN. I had a hard time making a case study for my psych class last summer because this is a group task. My group frequently calls, and that's it. We cannot even discuss a lot because of the time difference. That's how Dorothea actually explained it. Florence, 29, a Chinese and PhD nursing student, said that research is difficult but better than the others due to your background of having the command in the use of English language and having done one before from completion of research as a requirement in the Philippines from a Master of Arts in Nursing program, as they do not know the format and have no better background research. Research is a challenge, particularly in translating research work to English language. Research is very important to research, okay, the work area, and I expect that other courses will also include research utilization for better learning opportunities. So as of now, for the PhD nursing program, we actually have assistant advisors from China to assist our students, just so they could have research understanding better with translation from Chinese to English. The third one is a compromise engagement. Since all of us are actually having online engagement, yes, according to Betty, but maybe it is the disadvantage of online teaching. It is suitable for knowledge, but not for skills. Engagement, like in the case of the undergraduate program, the CHN exposure, okay, and other things that we do, okay, but the teachers promoted learning and independence in doing the homework. So what she was saying was they were given tasks by their teachers to actually interview deans or heads of the different programs and schools, so that from there on, it seems like they're also interacting with the people, okay, in the society and are learning from them. And at the same time, learning goes two ways. For Dorothea, 22, a US immigrant, BSN, said the CHN without engagement with clients or the community, also now school-related, we provided monetary and in-kind donations. So during ODEP, initiated to help 18 students from the College of Nursing from Kabangkalan, Baisipalan, Nuba, and those who are accessible as the ones to go there to help the people by bringing the donations physically. From the different experiences of our students abroad, most of them are saying that most of the things that they can do with extension is to send money, which they earn also abroad, so that they can help their classmates also disseminate and spread the kindness from their heart. The second theme is salient features in the lived experiences of international students in nursing education in the COVID-19 pandemic. The first one is technology utilization. So Betty was saying there's no problem with connectivity in China, but sometimes connection could be down, but only a few seconds and within a few minutes, I can connect. Okay, Dorothea, a US immigrant, was saying, I find it very limited since there's a short amount of student interaction, okay, or student-teacher interaction. It is sometimes interrupted because of connectivity problems and other external factors. Pre-recorded video lectures are highly encouraged. So my dear teachers and faculty, okay, they actually appreciate the recorded video. Next, we have Phil, 24, Filipino-American, and BSN. I was fortunate to have a stable internet and the devices needed. While being in the US, I had never a problem with connectivity issues and had multiple devices I could use. Rosano, 22, a Filipino-American, said that connectivity is okay, but not everyone in the States has a good connection. Most teachers would think that you have a very good connectivity. So usually they assign you to do a task like being co-host and admit classmates in class. Sometimes you would have resetting of Wi-Fi and blackout. And sometimes he would say, Rosano mentioned that he was quite embarrassed to do so, no, especially when there is actually a blackout. What he was saying is that he would like us teachers to actually understand that not all foreign students are having good connectivity. So we should not stereotype them. Second is managing time. Dorothea, 22, said that the experience in nursing education as an international student during the COVID-19 pandemic is challenging, especially since time is the most significant factor in learning. When I have scheduled night classes, I get to class as early as 2 a.m. in the morning. From that, my sleeping pattern is disturbed. Also, when I'm doing my homework in the morning and have specific questions about a particular task or topic, I have no one to consult because it's already bedtime in the Philippines. However, as months pass by, I get to be flexible and adaptive to this setting and know how to cope with it. Phil, a Filipino-American, in terms of time management, I had to stay up at night and sleep in the morning to accommodate for the time zone difference. This brought challenges to my day-to-day agenda, and I had to learn how to both manage to keep personal time to myself, my family, friends, and school with such a limited time frame. Most days, though, I stayed at home, attending my classes probably after 3 p.m. And I am really tired. Classes starting at 3 p.m. such as Gen Ed classes are things that kept me from resting as the time difference is almost 12 hours. What they were actually asking is for us to see to it that there are no long hours of waiting in between classes so that they could actually maximize time for having an extra job or resting for a moment or studying. Betty, 32, a Chinese, okay, said for culture and language integration, to be honest, we all felt confused because of the different cultures and languages. I do not know if I can do the homework, but I have friends and team leaders with whom I can discuss my lessons for clarity. And it's actually very refreshing to know that they help one another. Virginia, 32, said that Google Meet has so many functions such that a translator to the Chinese students can understand better what is discussed in class in terms of knowledge because of the challenge in the use of and understanding of the English language. So they were saying that in China, it's better to have Google Meet because there is an available translation compared to Zoom. Rosano, 22, Filipino-American, said, during the pandemic, it opened my eyes to day-to-day life, taking classes seriously and watching videos related to my classes, such as watching videos if I have time to look up whatever the CIs would suggest. So it's actually good to know. Maybe we can suggest more interesting videos to our students where they can learn from. For Team 3, lessons learned by the international students' experiences of nursing education during the COVID-19 pandemic. Practical lessons learned from the personal experience, often referred to as empirical knowledge, is one of the most critical findings in focus for the study. The lessons learned were taken from the participants' individual experiences, namely, One, online is very effective with teamwork, self-discipline, and confidence, as shared by Betty. Her belief that online learning is very effective is rooted in her more profound understanding of the different theories and being able to translate her learnings in class into research output in the form of a proposal with which she is proud of. B, call for checkup of international students from teachers. So they're asking us to actually once in a while check on them, according to Dorothea, to look into the international students' welfare, safety, and well-being. C, relevant learning to work placement with leadership and management, according to Florence, is the best experience for her, with her master's and PhD program being newly appointed as a director that helped her manage a department she currently handles. So indeed, we're doing well, okay, because she came here to study so that she could have better opportunities in China. Realizing the importance of face-to-face and hands-on experience in nursing education is perceived vital for field and beneficial to all nurses. Adaptability to different scenarios and situations is the best lesson for Rosano, emphasizing adjustment as key to his preparation as a nurse, given his readiness to the different scenarios and situations as a way to achieve success. And lastly, jump-starting research while maximizing English language usage for Virginia, who learned doing a research proposal through the encouragement of expressing one's opinion by using the language in class. So the participants' lived experiences highlighted three themes as follows. Divergent responses to the challenges in the trifocal areas of nursing education during the COVID-19 pandemic, which include, realities of teaching and learning with the threat of the COVID-19 pandemic, enriching research experience amidst the COVID-19 pandemic, and a compromise engagement, which we have to address, However, as we are doing the limited face-to-face now, I think this is being challenged and for us to be successful so that slowly we can have engagement carried out. The participants' lived experience also included salient features in the lived experiences of international students in nursing education with COVID-19 pandemic. And these are four. First, technology utilization, managing time, culture and language integration, and embracing self-reliance is key, in trying to address online concerns and challenges, toward the achievement of goal of finishing their nursing education amidst all odds. Third, lessons learned from international students' experiences of nursing education during the COVID-19 pandemic, include online is very effective with teamwork, self-discipline, and confidence, shared by Betty. B, call for checkup of international students from teachers according to Dorothea. Third, relevant learning to work placement with leadership and management according to Florence. Fourth, realizing the importance of face-to-face and hands-on experience in nursing education is perceived vital for field. Adaptability to the different scenarios and situations is the best lesson for Rosano. And jump-starting research while maximizing English language usage for Virginia. This is the program enhancement of international students' nursing education during the COVID-19 pandemic that came up following all of the themes that were called out. First, our teaching must be responsive so that learning will happen. We should have enriching research experience for our students, integrated in all courses and not simply in nursing research classes. There should be well-planned student schedule so that students who are abroad will have maximize and quality time with studies, families, and possible part-time work. Culture-friendly virtual platform should also be adopted. Promoting mastery of the English language so that our students will not only be learning the lessons in class, but will also have to target, one of our ELGAs, which is effective communication and inclusive community engagement, so that we can be socially responsible Christians. And with this, I would like to highlight, Spider-Man's uncle, but actually it was Voltaire who said, with great power comes great responsibility. My dear teachers, students, and administrators, caring about others, running the risk of feeling and leaving an impact on people brings happiness. And with that, thank you very much for all the time and the support in everything that we are doing in the College of Nursing, Animal Asal.
Thank you so much, Dr. Trajera. In this study, we go international. We have participants coming from China and United States. So some of the highlights of the study, the divergent responses and the challenges of the trifocal areas of nursing education. So the study revealed, discussed also the different realities in the teaching learning, like the limitation of feedback, difficulties of the students to focus. However, there were also some students who claimed of their positive experience, like the enhancement of the research learning. Some of the salient features that were mentioned include the technology utilization, the time management, the culture and language integration, as well as self-resilience. And the most important lessons also learned by our international students, the teamwork, the self-discipline, and confidence. Thank you so much once again, Dr. SHEILLA. And this time we will move to the next presenter. We have Dr. Leslie Yang.
Thank you.
The title of my study is The Quest for Independence in the Delivery of Flexible Learning Modalities in Nursing Education. The emergence of the COVID-19 pandemic has brought closure of schools and other learning institutions during the academic year 2020-2021. Clearly, the challenge has been how to continue teaching and learning beyond the usual face-to-face instruction. Flexible learning appears to be the most convenient instructional modality. It provides learners with increased authority about where, when, and how learning will occur, although it requires internet-based tools such as virtual learning environment. This study, therefore, was conducted in the hope that it will promote awareness of the challenges and experiences of the teachers and administrative officers as they strive to be independent in their approach in their delivery of flexible learning, as well as the students' struggle to learn independently on their own. The research paradigm pertinent to this study are the learning theories, Roy's adaptation model, behaviorism theory by Skinner, technology acceptance model, and from novice to expert model by Benner. These theories explain that amidst the changing times in education, the teachers, administrative officers, and students have to make adaptive responses that will allow them to grow, develop, and enhance the meaning of life in their quest for independence in the delivery of flexible learning modalities, leading to the creation of a proposed enhancement framework for flexible learning in the College of Nursing. The study aimed to explore the quest for independence in the delivery of flexible learning modalities, primarily of 3 nursing faculty members, 3 administrative officers, and 3 nursing students from the colleges of nursing in Bacolod City and in the province of Negros Occidental for the academic year 2020-2021. Data collection was done from April to May 2021. The study made use of qualitative phenomenological research. It is a qualitative research methodology that seeks to explore the lived experiences and the essence of these experiences to individuals. In this study is the quest for independence in the delivery of flexible learning. In-depth interview was also used. It is a one-on-one dialogue with the participants in order to understand their thoughts, feelings, and perceptions about the challenges and lived experiences of a certain phenomenon. There were 9 participants comprising primarily of 3 nursing faculty, 3 members of the administration, 3 nursing students, all coming from the top 3 nursing schools in Bacolod City and in the province of Negros Occidental during the academic year 2020-2021. A semi-structured interview guide was used in conducting the research. The tool was divided into 2 parts. The first part included the demographic profile of the participants for the purpose of their identification. The second part was the researcher-constructed semi-structured interview guide, which was approved by a panel of experts. After securing the consent, the researcher set an appointment individually for the scheduled online interview according to the participants' convenient time. Zoom meeting link was posted on the FB Messenger account of each of the participants prior to the appointment schedule. During the actual interview, the researcher started with a brief introduction of herself and established rapport with the participant. The participant was informed that the interview would take 30 minutes to an hour and was asked for the consent to record the interview to maintain the integrity and credibility of the interview process, and that recordings will be kept confidential and be used only by the researcher for the purpose of the study. Qualitative data analysis was done using Creswell's 6 steps in analyzing data. These are data collection, transcription from recorded and written data, reading through the data, coding of data, coding for description, and coding for themes and categories, while the ethical principles observed during the conduct of the study were autonomy, beneficence, non-maleficence, and justice. From the narratives of the participants, 4 major themes emerge. These are Theme 1, Faculty and Administrative Officers' Journey Towards the Request for Independence in the Delivery of Flexible Learning. Theme 2 are Students' Recognition of Teachers' Adapted Pedagogical Strategies. Theme 3 are the Complexities in Flexible Learning, and Theme 4 are the Rewards of Flexible Learning. On the theme Faculty and Administrative Officers' Journey Towards the Quest for Independence in the Delivery of Flexible Learning are the sub-themes on Dilemma in Curriculum Design, which speaks of the teachers and administrative officers' difficulty in revisiting, redesigning, and restructuring of the syllabi. Pain in the technological groundwork is learning how to deliver the learning content through online platform via LMS. And the last sub-theme is Faith in God Strengthened. On the theme Students' Recognition of Teachers' Adapted Pedagogic Strategies is the sub-theme on pedagogic strategies recognized by students which were helpful in acquiring learning. To name a few of these strategies are video presentation of case scenarios and simulation, pre-recorded videos of basic procedures, and a lot more. On the theme The Complexities in Flexible Learning are the sub-themes focused on poor internet connection, mental health challenge because of loss of connection between students and teachers, alteration in comfort such as Zoom fatigue, eye strain, neck and back pains, and the last sub-theme is external distractions coming within the household or outside the house. On the theme The Rewards of Flexible Learning are sub-themes on social synergy maintained and satisfaction obtained, such as savings on travel expense, food allowance, safety and protection from exposure to COVID-19. For the conclusion, the faculty, administrative officers, and nursing students were able to achieve success in their quest for independence in the delivery of flexible learning in nursing education. Flexible learning was and will be the answer to fill in the student nurses' needs in terms of nursing education during the pandemic. The following are my recommendations: that policies and guidelines be created by the administration specific to nursing education, the development of faculty enhancement program for continuous training, faculty use of pedagogic strategies recognized by students, and that students be responsible for their own independent learning, and similar studies be undertaken that will contribute to general knowledge in higher education's delivery of instruction under flexible learning. I would like to give my heartfelt gratitude to the following: Dr. SHEILLA M. Trajera, my expert advisor, who took the time to review my work, given me suggestions, and guided me to be able to accomplish this study. My panel members, Dr. Tony Ann B. Lachica, Dr. Jocelyn Mayflor A. Cadena, Dr. Lorisita Antonia A. Chua, Dr. Maria Luisa S. Pareñas, and Dr. Ramon Clemente Martin F. Lachica, who were understanding during my proposal and final defense. Their suggestions and guidance meant so much to finally come up with a better dissertation. To all my participants from the different colleges of nursing in Bacolod City, and to my ever-supportive family, and to the Almighty God be glory, honor, and praise. Thank you.
Thank you so much, Dr. Leslie. So in this study, there were 4 themes that were highlighted. First, the journey towards the quest for independence, like the challenges in restructuring the curriculum, the technological challenges. The second one were the different adopted pedagogic strategies of the instructors and administrators, the simulation, the flipped classroom. Also, it was discussed in the study, or in the study, it came out the different complexities of the flexible learning. Some that were mentioned were the Zoom fatigue and the mental health challenges of the students. And the last one also, of course, the rewards of flexible learning, like the safety and savings of expenses. Okay, so all those who presented this afternoon covered really relevant, timely, and valuable topics in nursing education. Thus, we are very thankful and grateful to all our presenters. This time, we will give opportunity for our attendees to ask questions. If you have any questions, feel free to open your mic and ask our presenters. Anyone? If you have any questions, you can ask questions to our presenters. We will be entertaining questions if there's any. Let's see. Having here none. Okay, so let's move to the next part of the program, which is the giving of certificates to our presenters and, of course, to our participants as well. To our presenters, after virtually receiving your certificate, you may give a few words of thanks if you want. Okay, you may. To our participants, at the end of this colloquium, at the end of this program, an evaluation link will be posted, and we would appreciate it if you would complete that and provide us with your feedback. And then you are going to receive your certificate for attending this colloquium. So let me read first. This certificate of appreciation is given to Dr. Marybeth DIVA. I cannot clearly read the text. Medyo blurry siya. Sige. Let me open the file. Okay, this one. Thank you so much, Sir OJ. Okay, for presenting a paper entitled Clinical Supervision in the Changing Landscape of Nursing Education during the USLS Nursing Research Colloquium given this 10th of March 2022 via Zoom at the University of St. LaSalle Bacolod, signed Dr. SHEILLA M. Trajera, the Director for Center for Linkages and International Affairs, signed Dr. Tony Ann B. La Chica, the Dean of the College of Nursing, and signed Dr. Romeo G. Teruel, the Assistant Vice Chancellor for Research and Engagement. A virtual round of applause for Dr. Diva, please. Thank you so much, Dr. Beth.
Thank you, Tin. Thank you very much, CRE. Thank you very much, CON, most especially to our esteemed Dean, Doc Tony, for all her support, you know that. And of course, to Doc SHEILLA, who have been making this study very feasible and very possible. Thank you, everyone, also my CON family. Thank you very much, Tin.
Okay, congratulations, Doc. The same certificate is given to Dr. SHEILLA M. Trajera. Doc, any words from you?
Thank you so much again to my College of Nursing faculty. I would like to also highlight this afternoon for thanking Sir Fitzgerald from the Sun, who is always joining us in this different research activities of ours, and also to all my mentors who are here and is still joining the College of Nursing. You are my inspiration for always doing my best, so my students and our students will actually be even better than us in the future. Good afternoon, and thank you very much also.
Thank you and congratulations, Dr. SHEILLA. The same certificate is also given to Dr. Leslie Young.
Good afternoon, everyone, to all my College of Nursing family, as well as to
students present this afternoon. Thank you for your time spent with us. And thank you also, Salle, for the challenge to be able to come up and finish this study. And of course, thank you to Doc Tony, to Doc Shi for always reminding us to do our research. To God be the glory. Thank you.
Thank you. And once again, congratulations, Dr. Young. And at this time, we will be also presenting the certificate for our attendees. So this certificate of attendance will also be given to all the attendees for attending the USLS Nursing Research Colloquium on March 10, 2022 via Zoom at the University of St. LaSalle Bacolod. Signed, Dr. SHEILLA M. Trajera, the Director for Center for Linkages and International Affairs. Signed, Dr. Tony N. B. Lachica, the Dean of the College of Nursing, and signed Dr. Romeo Teruel, the Assistant Vice Chancellor for Research and Engagement. So indeed, collective efforts yield a great outcome. To all our presenters, thank you so much for sharing the results of your research study. To all our attendees, thank you so much for your continued support to the University of St. LaSalle College of Nursing, to the NRES team, Sir OJ and the rest of members of the team, to the College of Nursing headed by Dr. Tony Ann Lachica and the rest of the officers, the Center for Research and Engagement, all the staff of the Office of Dr. Shai. Thank you so much for all your support. We look forward to seeing you on our next research colloquium. This is Christine Condes, your host, saying, stay safe and God bless everyone. Animo LaSalle.
Hail, hail, alma mater, hail to De La Salle. We'll hold your banner high and bright, a shield of green and white. We'll fight to keep your glory bright, and never shall we fail. Hail to thee, our alma mater, hail, hail, hail. Hail, hail, alma mater, hail to De La Salle. We'll hold your banner high and bright, a shield of green and white. We'll fight to keep your glory bright, and never shall we fail. Hail to thee, our alma mater, hail, hail, hail. Hail to thee, our alma mater, hail.